Testing. Am I on? I am. Hi, everybody. I'm Jen, and this is going to be part 2, really geared towards several benzodiazepine recovery tapering question groups that have recently come across, but really I'm going to try to provide some information about psych meds overall in general. My disclaimer is I'm not a medical professional and I'm not a lawyer. I will always try to make the distinction as to when I'm giving you my own personal opinion based on my own personal experience and what I now come to learn is irrefutable science, good science, and medical fact, and a little bit about legal recourse. Again, I'm not a lawyer. I worked as a paralegal in 4 different areas of law and office management, but that was like a billion years ago. I can tell you right now, I wouldn't even remember. Okay, let's start here. This is probably going to be a 3 or 4 part series. Part 1 was basically about my present situation and my benzodiazepine story, how I got started, and where things stand now. And we're going to be going over my disclaimers and qualifications. That was in part 1, but I'll do a brief roundup. My serious biases against the medical community and big pharma, what a protracted withdrawal is, and how dangerous withdrawals can be if tapering is done improperly. And most importantly, my big chair is for self-advocacy. I mess up on that word every time I try to say it. Self-advocacy. And better yet, self-advocate along with a ton of support, especially if you have somebody close to you in life that has never taken a benzo and has never had that problem, but can see how you function every day or lack to function every day, and can support you in this journey. I lucked out. I was just so blessed. I married a doctor. He's a chiropractor, but his instinct in medical diagnosis and his holistic approach to healing and correcting medical situations, he would have been a fantastic doctor. I think he stopped at chiropractic just so he didn't have to get messed up in that whole prescribing kind of world, but he's just been the most valuable resource. The second most valuable resource is Dr. Joseph, Josef, Tapering Clinic on YouTube. Do a search. I now consider him I'm a Christian, I'm not supposed to say this, but he is like the God of proper, accurate, transparent psychiatry, board certified psychiatrist that knows the score. He realizes exactly what they've done. And before we get started, just let me read a little sentence in a medical paper he just put up on the tape that I clicked on. The main areas of serotonin research provide no consistent evidence of there being an association between serotonin and depression, and no support for the hypothesis that depression is caused by lower serotonin activity or concentrations. Evidence was consistent with the possibility that long-term antidepressant use reduces serotonin concentration. They've known it forever. So, yeah, at part 1, I touched on my story. I told you I had been in complete recovery, totally absent since 1985 until 1998 when I sought just therapy. Looking back on it now, I can honestly tell you I was having a human experience. There was a lot going on in my marriage. I had a beautiful little boy, and things were going down, and I was getting a little sad about some stuff, and I was getting a little stressed out. Looking back on it now, regular cognitive therapy, like I knew in the 80s. I went in the 80s, because I was in early recovery and a lot of childhood trauma, which I'm seeing a whole lot of that in the backgrounds somewhere with people that wind up on these psych meds, albeit unnecessarily, unfortunately. So, I know by the late 90s, the whole game had changed up. I mean, the game was on from big pharma to the marketers to the medical community. I make an appointment with a therapist, walk in there, boom. Oh, okay. Well, before we start to work together, we like the clients to see the psychiatrist first. I'm not saying you need medication, but if you do, it will greatly enhance the therapeutic experience. I'm game, you know. I was still going to meetings 13 years later into the whole 12-step recovery mode, which I strongly believe in. Let me put that out there. I think it is still the best, most effective way to recover. However, things have changed. They're starting to catch up more so NA in that there are some families of drugs, unfortunately, where total abstinence is not possible, sometimes for life and sometimes for a period of time. It was so much easier, guys, in the 80s, man. You could just stop snorting coke, clean up your game, and you didn't have to take anything. All was well. Okay, so that was part one. And I did start to touch on what my disclaimers were and qualifications. My disclaimers are: I am not a medical professional. I live with one who has very, very good instincts. He's a chiropractor. His instincts are phenomenal. And, he knows a lot of doctors. And basically, they're all into the osteopath, organic, holistic type medicine, and it works. So I have that information, a lot of experience, including a present one that I can't go too much into, but I can say up until late, especially psychiatric industry, have been untouchable. If they put your life at risk or they don't know how to taper properly, I think with mainstream medicine, the best you can do is just get someone to prescribe. I'm not telling anybody to go against, if you're working with a provider, God forbid, don't go against it. But if it's not working, for me, what worked is just to secure a provider and establish my own tapering program, because they don't know what they're doing. The providers that I've run into, I'm talking 30 plus years of being on benzodiazepine, and they still have this antiquated method when you first meet them of, well, we can get you off in 8 weeks and we'll throw in some Seroquel or Effexor or some SSRIs, even though you've made it clear that they make you suicidal and that you would not take one to save your child's life. I'm saying that because I know nothing would happen to my child if I didn't take one. You just couldn't. It's the same with like cocaine. I could be drowning in a sea of that toxic garbage, and you could not get me to put it in their mouth. Dr. Yosef, I think he was being real generous, says 5% of the millions and millions of Americans that are on these drugs, benzos, are the mother lode. In terms of, you can get a lot of damage coming off drugs, and you can be real sick, like with narcotics and things of that nature. Hear this: benzodiazepine and alcohol must be medically supervised. They are the only two drugs, if abruptly withdrawn, that do have the potential to actually kill you, or at the very best, snap your mind, and sometimes there's no way to come back, even if they return the drug. If anybody's familiar with Dr. Jordan Peterson, an academic psychologist from Canada, I think he's now in America, and just kind of a genius guy. And this isn't his field or his topic. He just started his own college, but he had a benzo experience in which brain injury was done. And we're talking about a guy with a couple of bucks that has access to the best doctors. And, he, not violating HIPAA, guys. He shared his own story on YouTube as well. His daughter did too. She had a little thing like with Candace Owens going back and forth in it. And okay, my qualifications really are my experience, what I've learned about how the system operates, starting at big pharma, down to the marketers, down to the doctors. Basically, the deal is this, guys. In the 30s, 40s, and 50s, psychiatrists basically could make their money by institutionalizing people. You might have a private practice where you saw on TV they lay down on the couch and, yada, yada, yada. They don't do that anymore. If you see the psychiatrist at all, as opposed to a provider, the game's changed. Now, this happened to the entire medical community. I have been prescribed benzos and other drugs from primary care, OBGYN, gastroenterology. I could go on. Any and all types of specialists. Once that hit the fan in 1997, I believe, 95, 96, 97, yeah, my son was 3. Once that hit the fan and I learned it was a whole new game, I had a long way to go before I was to learn. Really, this is my opinion, it's also a fact, how nefarious and how greed-based the entire industry is. Now, there are some providers that are just ignorant. They're not evil, they're not nefarious, they're not greedy, or they're forced by their overseers to provide an inadequate standard of care, either based on, getting a billing and getting you to come back every month. But most of them, and I do mean most of them, especially if you're dealing with big groups and specifically, especially psychiatrists, are in on this big time. Okay, so in the 30s, 40s, 50s, that's how they made their income. Big institutions, a lot of experiments. A lot of times their patients were really vulnerable people that had no outside advocacy. I'm thinking of Tewksbury Hospital in Massachusetts. There are actually other buildings surrounding the area where Helen Keller, her teacher, actually took her to, not Tewksbury Hospital, she didn't have any experience with that, took her to one of these buildings when she was finally able to convince the parents to let her, go off and teach her on her own. But Tewksbury Mental Institution was in effect at that time. It's still up and running today, but it was the classic Alfred Hitchcock like horror story. Lethal, permanently damaged experimentation. I believe they initially dealt with the first antidepressants, which I think was lithium, and it wasn't in pill or capsule form. They literally would soak their patients in lithium like baths or salts and tried that. So somewhere along the line, maybe they were on to something, but by the time it exploded into a million different antidepressants, like I'm hearing now from Dr. Joseph, it started in the 80s. I didn't have that experience in the 80s at all. But in the late 90s, the science, the 3-month, the 90-day science they did to stop pushing these antidepressants is the Fauci did better. That's just my opinion. Okay, I don't want to go down a political road. But we now know everything he said has been debunked. He's the only reason he's not going to jail is because Biden pardoned him. We have debunked every single thing he said and absolutely made the connection to the lab in Wuhan that he was personally, financially involved in. All right, we do this. I think benzo patients, especially on a taper, go down rabbit holes. So bear with me, folks. I try real hard to stay on the path. And this is part 2. So that's my disclaimer. My qualifications, again, are my experience. And I was in a Christian-based 12-step recovery group in 2013. The pastor leading it is a recovered addict. And at one point, he could see, there were couples and just men and women in the group. Everyone was definitely helped, but men couldn't talk openly about some of the different needs that they had, and the same for women, especially if you were there with your husband or a boyfriend or significant other. So he decided to split the group. I hate that word split, anything divisive, but it was a good move. In the regular group, and then a men's meeting and a separate women's meeting. And he asked me to lead it. And so I did. And within a month or two, you could see the people that was struggling with benzodiazepine, if it could come out openly in the group at all, because it's so shame-based, especially for women, and more so if you're a mother. Fathers have it too, good fathers. But if you're a mom, the fear and the shame base and the punishment that both society and even the law will impose on you, the possibility of losing a child, it took a long time to hopefully support women and make them comfortable, and that eventually spun off into a separate group for women, specifically on psychiatric drugs, and the mother lode being benzodiazepine. So I've worked one-on-one personally over the years. I'd say like 100 women and a few men. The group went on until 2016, I believe, and then it was more of a one-on-one thing, and the experience I've had with the doctors. So that's my qualification and disclaimer. Okay, my biases that I need to be real transparent about. My biases is, first let me say, if you're under medical care and you have a provider and it's working, never go against your provider's advice. If it's not working and you feel something is amiss and they keep adding more or making suggestions and you've been doing it for over a year and it's not working for you, you're in the right place. That's not the right provider for you. That's my opinion. The previous sentence was fact. Okay, so the institutions in the 30s, 40s, 50s, that's how they made their money. I think I shared in part 1, the surgery, a hysterectomy, actually came from a diagnosis that women were often mislabeled with back in the 40s and 50s, early 60s. If a woman got upset, or we were having a bad day, there was a likelihood that you could get labeled with hysteria and institutionalized. I mean, the patriarchy was really forced in that situation too. But that's where the word hysterectomy came from, hysteria. Women who were having trouble conceiving, there was a lot of shame around that, especially back in those days. According to certain religions, you were just expected to have big families, etc. So as we progressed into the 60s and 70s, the feminist movement, which I'm not going to get into, or how I feel or what I think about that because it's irrelevant to the topic, happened. And one good thing that did come out of it was we were more hip to that. And people didn't have the power, and doctors didn't have the power they once had to slap a label on you and put you in an institution. They still have a lot of power to slap a label on you and ruin your whole life, your reputation, and make you feel like a piece of shit. So they had to come up with something else. People were pretty stable back then, let's call it. It wasn't just because we didn't have the internet. I mean, you can read books, look back at older movies. Society was different and more stable back then. Somebody was a little quiet and shy, maybe even a little sad, even depressed. It is part of the human condition. Please see Medicating Normal on Netflix. But it was a different time. So for psychiatry, that was a big suck. That was a big loss. The other medical specialties were doing okay, but it was then discovered they could do a lot better, financially and materialistically, at our cost, at a great cost to their patients. And like I said, I'm not putting every provider under that blanket. There are some that are just ignorant and don't know. There's some that still believe the antiquated ideas, which is a problem because your life could be at risk if you have a provider that really pushes that. And the greed. And sometimes it's not even the actual provider. It's who oversees them that is pushing them, to get I remember one provider, I'm not going to name names, because there's a pending lawsuit actually going on with another one. When I refused all antidepressants, I was basically there to make sure my prescription was filled for my tapering program. And of course, they still to this day are pushing it. I already knew. I haven't taken an antidepressant since 2006, I believe it was. My 40th birthday. I'm 62, so it's been a long time. But push it. Well, they were going to give me the benzodiazepine, but they really... So I explained to them, antidepressants and SSRIs cost me my life. I had a moderate depression that would have passed on its own, with or without just regular cognitive talk therapy. But I got on the merry-go-round. I did not know any better. Does that set us free of all responsibility? Yes and no. No, in that we really didn't know. I've yet to find a patient that was put on psych meds that was fully informed. They can't fully inform you and tell you the truth, because then there would be no way to justify actually giving them to you. Yes, because we made the decision to go fill the prescription and take them. Okay, once they're in your system, first of all, this is something Dr. Yosef mentioned, and it's very important. The thumbnail was titled, Is It You or the Drug? And his point was, we already know that the drugs are very damaging. The very thing they claim to cure is the very thing they cause very significantly. And it's a big problem if you're a mom. It's a big problem for everybody. I'm a little biased because I am one. But you go to your doctor, you're seeking a little help, and all of a sudden, out of the blue, you're being told that you have a chemical imbalance of some sort. There's something physiologically wrong. Your brain's not wired like other people. We heard this in a proper way, maybe in a 12-step program, but no, they're talking about medical justification for something being very wrong with you that may require you to be medicated for life. Oh, but there's no shame in that. Absolutely not. You got to look at it like you're taking a vitamin because you have a little vitamin deficiency. This is the game they pushed. So right there and then, before you even get the prescription filled, you've already changed. You've already changed the way you see yourself, the way you feel about yourself. You look in the mirror, and some of you relieved. I was. Oh, okay. So this really isn't my fault. There's a reason I feel this way. I have a chemical imbalance. So right off the bat, you're seeing yourself in a totally different light. Sometimes we're relieved, most of the time we're ashamed, all the time we're scared. But that's the hook. This is where we get dependent and we believe we need these drugs. And if you're already on them, this doesn't apply to you. I can't. I was just recently spent time with a close friend that is on Effexor, and she's been on it for years. Family members. I would never tell anybody to stop, honestly, because it's too late. The brain's already been rewired. It could be damaged. But she was saying, after years and years of being on this, she went away on vacation. She got home and she just forgot to take them for like 3 days. She lost her mind because there's a brain injury due to the drug and that abrupt withdrawal of it. So she went cuckoo. Bad stuff happened. We'll just leave it there. And then she remembered and she took it and she was fine. So unfortunately, after years and years of taking it, there is a great danger of tapering and coming off it, especially improperly. But the average provider will tell you, you'll be fine. If you insist on cutting down, the first thing they'll do is try to talk you out of it. They'll suggest that you change and try something else or up your dosage. Sometimes if they have a little mercy, they might suggest lowering your dosage, but that's rare. They're in this for the long game. Trust me, guys, they are in this for the long game at your cost, at the cost of your life, your mind, your well-being. It is the biggest hypocrisy of the Hippocratic oath that one could ever experience in the medical community. And psychiatrists are the most guilty, although they all dole it out. That's starting, the tides are starting to turn on that. They're getting hip that we're getting hip. So sometimes, like, if your primary care has been prescribing it for years, they might say, oh, you know what, no, we got to get your pain management, or we got to get you into psychiatry for this medication. So they're getting nervous, and they know that we know. Kind of like, Scientology. If you're a Scientologist, nothing against you. But L. Ron Hubbard could not anticipate the internet and what we were going to find out, and the truth we were going to be able to not only find out, but share with one another. So it kind of took them down and took them out. That's slowly happening with the medical community. As I said, I have an upcoming lawsuit pending. My mind was blown away. This is a major law firm. When they ever said I had a case, I couldn't believe it. I kind of called them out of anger. I was just so bullshit. I called them about something before, and they were just blunt straight out. No. Yeah, they'll recommend you to another attorney that doesn't take it on contingency, and you have to pay a retainer to give it a shot, but they basically, you don't have a case. When I called about this, basically out of anger, and because I told them I was going to do that if they did what they did, and they said, you have a very strong case. So that's underway. But that's my disclaimer. Those are my qualifications. I know I go down rabbit holes, but if you're experiencing or on psychiatric drugs or trying to get off psychiatric drugs, or you don't have any of this information yet, you're in the right place. But we do all tend to go down rabbit holes sometimes. I've already gone over what I wanted to do. I wanted to keep this at 20 minutes. So I'll give 5 more minutes to wrap up part 2 and start going into part 3. It pretty much covered how it works with Big Pharma now. So they developed on this bullshit science all these SSRIs, and they had These are like genius scientists, so of course they know. Number one, serotonin is made in the gut. It has nothing to do with your brain. It's made in the gut. Based on it, of course they knew. I don't know how much of the way they can harm you. If that was full knowledge, it couldn't be because it was new. You need 10 years. Now they have a ton of research, good science, backup science. I can't recommend a Dr. Yosef enough. He would have been censored. He would not have been able to do that. We're talking some powerful lobbyists and companies and corporations, starting at the level of the pharmaceutical company, the lobbyists that, they have the laws in Washington. Big powers that be. So they take it down to the marketers. Now, the marketers are probably the most guilty ones because they also know these are very harmful drugs, but they're the ones that go directly to the doctors and push this stuff. And the doctors are rewarded. That's been proven. That's not my opinion. A lot of them have been busted now for fraud, for putting the bonus, under the wrong accounting category to hide it. They become BFFs with the doctor. They get to know the wives. They're at the kids' graduation, elaborate vacations. It happens. That's not opinion. That's fact. I can give you resources, just ask if you don't believe me. All right? So they push it, and they get the doctors to push it, and we suffer. We suffer from it. Not only does it not help, it actually causes harm. Dr. Yosef, like I started to say, generously said, out of the millions and millions of Americans that are taking these medications, we are still the most depressed and anxious country in the world. We're the highest prescribers in the entire world. They know. And what they don't know is how to taper off. They kind of, got something going like with narcotics, fentanyl, heroin, real addictive narcotics that, you can't die from withdrawal. You can't. You're very sick. You probably feel like you want to die. I've watched people withdraw like cold turkey. It is a nightmare, but it does end. 10 days to 2 weeks, the physical symptoms stop, and you just have to deal with the psychological part. But now they have Suboxone and methadone. They're going to find a way to make their money, but it works for people. The rate of relapse, because the brain knows the suffering that it's about to endure when you're coming off a narcotic. And from what I've seen, people that are on methadone, you have to get up at 5 o'clock, make sure you're at the clinic on time to get your dose, but it does enable like heavy duty fentanyl addicts to recover in that with that dose, they are able to function and work, go to school, have relationships, and have a life. I think gone are the days, not the 12-step days, but the days of total abstinence. The old timers will always push for that. But with benzodiazepines and certain narcotics, I am all for it. I am all for that replacement, because the brain will, long after you put narcotics down, the brain will keep telling you of the comfort, the temporary comfort, the temporary comfort, the temporary relief, the temporary relief. And it'll be a constant battle. And the rate of relapse is like 98% or something like that, without a substitute. And they do seem to monitor that much more responsibly. I know at least in one state, if they find something else in your urine, they'll actually up your dose of methadone. I think that's how they get it financed. That's how they justify the need for it. So, again, like it's a big scam, but at least it works. At least it works. It is not causing harm, and it may be preventing relapse. So great. Benzodiazepines are a whole different animal. A whole different animal. And little to none know how to taper from them. That's why if my support groups are watching this, each other, y'all, wear your tapering program, wear your support system. It's really interesting. All this argument we're having about, I don't even want to get into the trans stuff and the men and women sport, but here's where I see an incredible biological difference between men and women. I've always seen it, but in these support groups, the women are the ones that want to interact and talk, and they'll tell you more about how they're feeling going through the process. They're the encouragers and the cheerleaders. Where the men, the left-brain men, here's what I'm on, here's what I'm going down to, what should I expect, and what do I do next? Seriously, and my husband's the same way. We've gotten to a point where we pre-qualify before we have a talk. Whether this is, I'll let him know ahead of time, or he'll ask, is this a issue that you want me to fix and offer advice, or do you just need me to go along with you? And yeah, she's a bitch. She shouldn't have done that. And we're there. So works out pretty cool. I know this is getting too long. Part 3 is going to be, actually I added a section. I think before I get into protracted withdrawal and what exactly that is, I want to talk about what's going on with the urinalysis and clonazepam. That is critical. They've been coming back negative. Any other benzo will show up. I've had a few in the group say Xanax didn't show up, but now I have widespread information that benzodiazepine is not showing up, and it's happened to me. Luckily, my provider did a secondary screening, and then all the other time, and it showed up on the secondary. All the other times it didn't show up, by then there was an established relationship. And what they said was, I'm not worried about it with you. But what they mean is they know it's happening, but they don't want you to know that they know, and they will brush by the subject. And the reason there is a pending suit, a doctor abruptly cut me off based on a negative urinalysis, even though previous providers were more than willing to provide proof. The first time it ever happened, I thought they were up to something. The provider had to be up to something, because benzodiazepine, the truth of the matter, has not been in my system for 30 years. Consistently 2 milligrams for the past 4 years, every single night at bedtime. That's when I take my dosage. That's where I'm at, where my taper. It's always in my system. Has been for 30 years. Unless I wasn't experiencing an intense withdrawal. One weird place actually used benzodiazepines to wean you from benzodiazepine because they don't know what they're doing and they want to keep this thing going. But anywho, I want to add that topic in because it's very... I got one explanation that might have been acceptable, but from what I've been able to gather from 2 different states now where it's happening, definitely in the state of Georgia, I think there's something more nefarious. I'm going to do some more research, but that's the bottom line, guys, that you need to be aware of. If you're tapering and your benzo is clonazepam, aka it's Klonopin, the generic name is clonazepam, it's not showing up in urines. Why? And I'm talking about the strips they use in doctors' offices and labs that they send the urinalysis out to. I spoke to one of those labs last week. I'll get more into that. Generally, they do a general drug screen. I think it's like 8 different things they look for. Narcotics, specific narcotics, benzodiazepine, of course, has always been in there. It has always showed up on every test. The first time they told me, questioned me actually, you know, why is this negative? And they know. Tons of people were coming back negative. But the thing was, it was an on and off again thing. And just my luck with a new provider, all of 25 has been fine. Last appointment, or the urinalysis that was provided to them, came back negative. It was my pee. It should have been loaded. That's just the truth. So I think for part 3, we're going to get into that. I want to look into that a little bit more, but you need to beware. As I said, it was negative. It had been negative before. No secondary test was offered or given. It'll show up in the blood still. It'll show up in saliva. And it'll show up in a secondary, more sensitized urinalysis. And that abrupt shut off bought them a lawsuit. And I know I've screenshotted everything that was said. They use a messaging system. And also, an iPhone, you have the ability to record. I didn't ask permission, so they never refused permission to record. But I knew things, they were just lying and bullshitting about a lot of things. I'll fill you in on that, just to empower you to know that you have legal recourse. They cannot leave you in that state because it is life-threatening. And any damage that is done to you as a result of their failure to provide the most basic fiduciary care and follow up if there are any issues, to make you wait any significant amount of time, even if they want to discharge you as a patient or change your treatment plan, they need to let you know. And they need to, even if they're going to cut it, they need to keep you on your dose, because it is deadly, or can be deadly, to come off at the very least. A lot of damage can be done. So to have somebody going through this, and to have their attention for 42 minutes now, God bless you. Thank you. I'm going to go live on the group today so we can interact. You have any questions or comments, leave them below. I am certainly not a big YouTuber with a lot of views, so I am easily at this point able to answer and interact with any questions, and hopefully go live soon. And at that, y'all be blessed. I'm going to try to get to part 3 and 4 at some point tomorrow, or maybe later this evening, and it'll be uploaded by tomorrow. Deuces.